Now, these cases were all performed in Germany. The techniques, I think, have been exported to the United States at this point for the most part, but we're going to describe the German techniques. Here in Dr. Sattler's clinic, which is called the Rosenpark Clinic, the nurses are preparing the patient for surgery with preoperative photography and monitoring equipment with pulse oximetry and continuous blood pressure monitoring and also continuous cardiac monitoring. Now, Gerhard, we're giving the patient some kind of medication intravenously. What is that?
Well, sometimes we give additional sedation if we need it, but that's just more for security reasons. We have an IV access.
So this is just for the safety of the patient to secure an IV line just in the event of an emergency. Now, most of your patients, and most of my patients for that matter, are treated without anything at all or very little in the way of sedation. The tumescent local anesthesia is enough for the entire procedure to be done. Now this, here you see Dr. Sattler doing the preoperative markings on this patient.
It's always done in a standing position, of course, and the patient looks into a mirror and controls and agrees to the marking in order not to treat wrong areas or wrong aspects which should not be treated by the opinion of the patient.
And this is really a very important part, is the preoperative plan. The preoperative plan in liposuction is your roadmap. The patient needs to be in agreement with this plan. And if you lose these markings, it becomes very difficult to complete the case. So this is done with an indelible marker. Here the waist and flank area is being marked.
Especially with the flanks, it is important to outline the complete aesthetic unit instead of just having one little bulge area, which is the focus of our attention. So we always outline the surgery in aesthetic units.
And some patients are asymmetric. They're slightly different on one side than the other, so oftentimes the markings are slightly different on the two sides. And here you see the patient who has been prepped with an antiseptic solution and now is being prepared with sterile drapes in the operating room. This just shows the monitoring equipment that's used for pulse oximetry and continuous pulse and blood pressure and cardiac tracing. And this is a clip to hold the tubing in place so that it doesn't disappear from the sterile field during the surgery.
This is the vibrating device what we use.
Now there are different types of cannulas that can be used, and usually when we have a beginning liposuction surgeon, we recommend that they begin with hand cannulas rather than powered cannulas. This is a powered cannula which is developed by Dr. Sattler called the Vibrosat. It's a vibrating cannula, it's a reciprocating cannula, and it allows the area to be treated with less discomfort, both to the patient and the physician. And in this case, Dr. Sattler is indicating that the cannula needs to be held at a significant depth in the fat so that it doesn't get too close to the skin And here you see it's too close to the skin with the tip of the cannula right under the dermis. And this is not the proper technique. The proper technique is to see the tip not at all because it's very deep in the fat.